The Niger state government has flagged off the latest round of polio immunization campaign with a strong appeal to parents and caregivers to make their children available for the vaccination. The governor, Farmer Mohammed Umar Bago, who was represented by his deputy, Comrade Yakubu Garba, performed the flag-off ceremony at the Emir's Palace, Mina. NSTV correspondent Ahmed Yusuf was there again and completes the report.
The event was well attended by traditional rulers, health officials, development partners, and caregivers from across the state. While addressing the gathering, the former governor of Niger State affirmed the state government commitment to eradicating polio and strengthening routine immunization. He urged parents, caregivers, and community leaders to dispel myths around the vaccine and ensure that all eligible children aged 0 to 59 months are immunized during the exercise. He said polio is a vaccine-preventable disease and no child should be left behind. The governor called on all parents to bring out their children. They can sustain their polio-free status in Niger State and Nigeria at large.
In Niger State, I think we are doing very well. But I want us to look at it in a practical way. You cannot say that you live in a community where nobody should come in. No matter how clean we are, people are coming from other states into the Niger State. People are going out. Niger State is a connective state between the south and the north, and between the north and the south. So you should expect that people will come in and they may come with these pathogens. So those are the kind of cases we are witnessing in Niger State. Otherwise, in Niger State, the compliance level is 95%. We cannot get it 100%. However, I want to make this very clear that our health workers should be very vigilant. Then our senior health workers should monitor what the younger ones are doing to ensure that, yes, the right thing is being done, especially at the borders areas. We must ensure that actually we vaccinate anybody who is coming to Niger State.
Also speaking, the Commissioner, Niger State Minister of Health, other stakeholders also sensitized caregivers on the safety and efficacy of oral polio vaccine, noting that vaccination team will move from house to house, as well as to school, market, worship center, and other public places throughout the campaign period.
The event speaks directly to the health and the future of our children, and by extension, the long-term development of Niger State. I also wish to recognize and appreciate the efforts of Chanchaga Local Government Council, the Mina Emirate Council for their commitment to mobilization of the whole community and for bringing people together in support of this exercise. This reflects the shared responsibility we all hold in safeguarding public health. This flag-off is another clear demonstration of the commitment of this administration to improving health outcomes under the new Niger Health Agenda, which remains a central pillar of the broader development agenda of His Excellency.
Earlier, the Managing Director, Niger State Primary Healthcare Development Agency, Dr. Junedu Inua, highlighted that the vaccine is free safety for children and called on parents, caregivers to endeavor to make available their children as the health personnel will go in house to house for the vaccination.
The collaboration between government and community stakeholders continue to strengthen our healthcare response system across the state. Distinguished ladies and gentlemen, permit me to provide an update on the current polio situation in Niger State. As we are aware, Niger State occupies a strategic position in Nigeria due to its vast landmass and connectivity to several neighboring states. This strategic location also places a greater responsibility on us in managing public health concerns, especially communicable disease. Most of the neighboring states harbours the off-pan polio virus in the last quarter of 2026. Unfortunately, and very recently, our surveillance system detected a case of variant polio virus in a 4-year-old child in Gulbi-Boka ward of Mariga local government area. In addition, periodic environmental surveillance conducted into the Wada North of Chenchaga local government area returned a positive result from the National Reference Laboratory.
In their separate goodwill messages, the development partners, including WHO, UNICEF, and the National Primary Healthcare Development Agency, commended the state government for its leadership and reiterated their support for the campaign.
In our most recent campaign that we had in March this year, we were able to reach over 2.8 million children across the states. The result of strong leadership, political will, as well as thousands of health workers who work difficult terrain, the community mobilizers that knock on different doors, the community leader as well, as at all levels can make this work possible.
The host and chairman Chenchaga Local Government Council, Dr. Mustapha Jibril Alheri, took time to appreciate the traditional rulers, religion leaders, and partners for their tremendous support and contribution towards the success of the exercise in the state. He said the council is playing a critical role in providing an enabling environment to ensure smooth polio campaign exercise in the state.
District heads, the community heads, the ward heads will all be aware of what is happening. Now, I, as the local government chairman, is to also ensure that that's why I'm here today, that I participate in all that they are doing. I attend all their meetings. It's a 4-day program. At the end of every day, we do a review meeting every day. And I attend all of those meetings. Yesterday, I attended the meeting, and I listened to what the challenges that they have when they are on the field and at the spot to try and resolve all of those problems. Before this immunization started, they complained that they didn't have enough, needed one extra fridge. And then financially, whatever support that we need to carry out our daily review meetings have been given them.
The flag off ceremony ended with the symbolic administration of the vaccine by Deputy Governor, signaling the official commencement of the exercise across the 25 local government areas of the state. Ahmad Yusuf reporting for NSTV News.